Welcome to the 10th episode of our podcast series, Health Frontiers Insight from Global Experts. On today's episode, we dwell into the intersection of healthcare, leadership, and inspiration. We're calling it Leadership and Inspiring Lives with Mr. Vivek Atri. Sir is a former IAS officer, a TEDx endorsed speaker, and has published numerous books like Move On Bunny and Bounce Back Dubeji. So, sir, I've seen that your career trajectory is remarkable. You've served in the Indian Administrative Services and then you switched to becoming a motivational speaker. I can only imagine it must have been a roller coaster. So, can you tell us more about your journey so far?
Yeah, life is a roller coaster. Everybody goes through this kind of turbulence. Mine seems a little more dramatic because I was in the civil services, which nobody leaves normally. But I resigned and I became a motivational speaker. So it was just a calling. I felt that I could speak more often. I could reach out to more people. And I wanted to speak on stage and camera. So I started this journey about 7 years ago. And I resigned because I had done 24 years in the service. And I wanted to do more now outside. So otherwise, I could have remained 11 more years in the service and done my bit for the service. But I think I'm doing more for society now. So I think it's been a roller coaster, but it's been very exciting.
That's very insightful, sir. So, as your journey, in your journey as an IAS officer, did you encounter any unique stories or experiences that has shaped you as a person or have changed your course of decisions or thinking?
Yeah, many times you learn from people, from incidents, from happenings. So my father was an IPS officer, police officer. I used to watch him, how tense he would be at times because of his work. And yet he would take out time for the family. And sometimes he would even carry his own weapon in the car because they were terrorism days. And it was a tough life for him. But one learned to see how cool and calm he was overall and how he used to handle situations. Then I learned from people, common people, like poorest of the poor. They will come with dignity. They will come that, I'm, sir, garib aadmi hai. But he wants that right which he has. So you learn from such people that I may be poor, but I demand or I need my respect. So I also learned to respect people from different backgrounds, different circumstances, different mindsets. And therefore, I became more evolved myself while interacting with different kinds of people. So every time if you have to interact only with a Zomato guy, Blinkit guy, then you will remain that level. But here you have people who are from all walks of life. I mean, nothing wrong with Zomato, Blinkit guys. It's just that you have to be multi-dimensional.
Yeah.
So I think that multi-dimensional exposure made me evolve as a person in the service.
Thank you, sir. And in your lecture, you talked about emotional intelligence. And I believe emotional intelligence is not something which is a common topic of discussion in India. Even in our upbringing, we are told to snub our emotion and focus on the goal, more or less. So how would you say that emotional intelligence is a crucial part of leadership and how it can be developed or harnessed to make one a better person?
Absolutely true. Even as a human being, without being a leader, although we are all leaders in some way, but in everything you need emotional intelligence. When I gave the example of somebody who's a courier boy, it could be the milkman, it could be the rickshawala, it could be a poor beggar, and how you interact. Now, when a beggar is there at the roadside and you don't carry any change, there is a way to talk to that person.
Yeah.
I mean, you may not be able to give that person anything, but you don't need to talk in a rude manner. That is emotional intelligence, retaining your calmness, speaking gently. Mm-hmm. I'm sorry, I don't have any change. Or Hindi mein. Or the child who has come, I always tell that child, school jate ho? Mm-hmm. And that child then doesn't want to answer this question because the parents have always been, pushing them to begging. So then the child starts evading. But I always say, school jao. So basically, it depends on how you interact with people, how you retain your emotional intelligence by being calm, Not losing your temper when you want to lose your temper is a great ability.
Definitely.
Not worrying when you feel like worrying is a great plus point. So these are all facets of emotional intelligence. Everybody is human, but we try to improve our emotional intelligence bit by bit gradually. I think I have improved, and I'm trying to improve further.
So how would you say emotional intelligence is part of being a leader,
Yeah, you talked about the leadership part earlier also. So leadership is about bringing out the best from your team.
Yeah.
And by being an emotionally intelligent person, that means you are displaying those leadership qualities which they need to see.
Yeah.
So if I am going to be abusing people, criticizing people, clients, others, then they will also start doing the same.
Yeah.
And if they see that despite all the problems, our boss or our leader is maintaining calmness, maintaining dignity, maintaining a happy overall attitude, cheerful attitude, then they also become like that. So that attitude is something which they need to imbibe. And a leader is one who absorbs the shocks,
Yeah.
who doesn't create tension for the people. So if I am a boss who is creating extra tensions for my team, then there's no point of my being there. So I need to reduce their tensions by being a high level emotional intelligent person and by being a shock absorber and an encourager. So I think a leader has to display and imbibe these qualities.
Definitely. So, sir, as a former IAS officer, I'm sure you're aware that the healthcare system in India is not the best. We're working on it. We'll get there one day. So, what do you think are the major challenges that we face today and should be the priority we should work on?
I think as an observer and somebody who's been involved in administration, I've been deputy commissioner, worked closely with the chief medical officer and others of the district. I think I have seen that quality-wise, medical knowledge-wise, I think we're very good.
Definitely.
I think doctors are excellent in their fields. I think paramedics, nursing staff, others are all very good in these fields. But I think that we are not preparing them for situations and crisis and preparing them for leadership roles. So while we are giving them that medical knowledge, that scientific knowledge, we are not preparing them to be heads of hospitals.
Yeah.
So hospital administration has come as a course, but I don't think that doctors who become heads are undergoing any kind of training of leadership.
Yeah.
So that training, that education, that those kinds of workshops, those kinds of interactions with leaders are required by specialists. So specialists will also one day become principals and directors and heads of department, where the most of the work is people handling.
Yeah.
So even as a junior doctor, you are dealing with patients and their families. Whereas your medical science is one thing, but dealing with patients and families is another thing.
Yeah.
So my emotional intelligence as a leader has to be developed in that. So I think in India, we need to focus more on all-round leadership development of medical staff, of how to deal with people, how public expectations have to be, sometimes you have to be cool and calm despite people shouting or saying something in healthcare. And also management of resources, people, financial resources, material resources. So I think this component has to be strengthened in India, where we train doctors and medical staff to be leaders. That part needs to be worked upon in India.
Definitely, sir. Hopefully one day that can be part of our curriculum.
This is a start. At least we're talking about it.
Yes, definitely. So apart from these qualities that you've mentioned, do you think a leader in healthcare is in any way different from the leaders that we have for our society?
I would say one thing is very important in healthcare, which is empathy, which is caring for others. Because healthcare is care.
Yeah.
So care is the key word. As I gave an example in my talk, if I'm the MD of Coca-Cola, my empathy levels need not be very high. I need to make good Coke.
Yeah.
I need to ensure the timely supply. I need to ensure that the market is doing well, that my sales are good. So there, my empathy may be there for the team. But the empathy for the public at large is not that important.
Yeah.
Whereas in healthcare, it is very important for everybody to have that empathy, that caring attitude. So in healthcare, the leadership has to be extra sensitive, extra caring, understanding. So understanding others is very, very difficult. I mean, there is a joke that there's a man and woman talking and the man says, so I've not been able to understand ladies, so please help me to understand ladies. She said, I'll tell you a secret. We haven't been able to understand ourselves. So it's very difficult to understand others, but we have to try and be as empathetic as possible.
Definitely. So, sir, my next question comes about your lifestyle. You've achieved so much. You've done so much around for the society and for yourself. So, how do you balance different aspects? Because that is something we all can learn from somebody as accomplished as you are.
Well, there's a long way to go. I feel achieved something, but still lots to achieve. And it's not only numbers, it is that impact which you create in the society, because there's a lot of negativity in the society.
Yeah.
So someone like me who's trying to spread the positive vibe and trying to prevent youngsters, especially from overthinking, being stressed out because of competition, expectations, that is my job.
Yeah.
So I still have to achieve a lot in that.
Yeah.
But yes, like you said, so balancing is the key. I think work-life balance. Your self-development is also important. So your physical fitness, your mental fitness, your spiritual fitness, your meditation, you're taking out time for your family, for reading, for conversations. I'm a strong believer in conversations, coffee, whatever. So the thing is that we have to talk, listen, interact. We can't be on social media all the time. We have to sleep enough. Balance means that we are all-rounders who are, firstly, you have to be healthy to do whatever you have to do.
Yeah.
So to be healthy, you have to look after yourself. And then to be a good listener, caring attitude. So it's a very difficult thing to accomplish, to be very balanced. And all of us have weaknesses, but we try.
Definitely, sir. So, sir, the next question, it's about how healthcare frontline workers. We all know that everybody undergoes immense pressure and stress. So, how can we keep our motivation and our morale high in the times of crisis?
I think everyone has different levels of morale and motivation. So the one who is in the middle somewhere, reasonably motivated, reasonably also not motivated, so middle somewhere, has to look at the example of others who are more, inspired. And the person who is the most inspired has to try and improve himself by challenging himself.
Yeah.
That, I am otherwise a very motivated person, but I can be even more motivated maybe. Or you can look at people like Usain Bolt, Virat Kohli, someone else, Alia Bhatt, anybody, that I can be someone who is more achieving, more famous, more motivated. So something has to keep on inspiring you.
Yeah.
So the person who is with the lowest motivation, we can talk about him also. So he is someone who's obviously in need of some understanding from others. He can't self-propel himself because he's at the bottom of the ladder.
Yeah.
So some encouragement needs to come from the leadership. Some response has to come from him also. So there is a saying, a spiritual saying, that you start walking towards God and God starts running towards you. Which is a beautiful saying.
Yeah.
So who is covering more ground? God is covering more ground than you.
Yes.
You are just taking 2 steps. So in motivation also, you take a little bit of effort and you'll find that motivation will come running to you.
So it's basically like fortune favors the brave.
Yeah, absolutely. So just go for it.
So, sir, any final message that you have for the youngsters of India?
I think the healthcare professionals, firstly, I really feel proud of them. They've done great work in difficult times and they continue. I think they're already in a field which is so empathetic. So they need to keep their motivation alive, their calmness alive and strong, and keep inspiring themselves through various ways, yoga, meditation, are role models. And youngsters especially, they need to stop overthinking. They need to reduce their worry, reduce their stress, reduce comparison.
Yeah.
It is human, but we reduce it.
Yeah.
So we have less pressure on ourselves or our minds. So I've been writing about this. I keep speaking on this, my Instagram, my LinkedIn. I keep posting about all this. So one day we'll improve situations.
Thank you so much, sir. It was really nice talking to you. And with this, we come to the end of our podcast episode. Stay tuned and we'll bring you another episode of our podcast series, Health Frontiers, Insights from Global Experts tomorrow. Stay healthy, stay informed. Thank you.
Thank you.